The end-of-life programme is quite a broad programme. It's got pathways of care, which is looking at how we organise services to enable people to remain at home towards the end of life. It's looking at how do we support family carers to support the patients and at the same time look after their own needs. And the third strand is developing local priorities for end-of-life care research to make sure that what we're actually looking into is relevant to local services and local patients and carers.
My experience is that carers feel very often deeply cut out of the system. Things were happening to someone they loved very dearly and no one told them why and no one told them what to expect. And I'm really concerned that we find out what the needs of carers and what the needs of people towards the end of life are too.
We've done a national survey to find out about how many hours of care carers put in to support patients towards the end of life and how much money and effort and so on. We have developed an intervention to enable practitioners to use a carer support needs assessment tool to identify what carers' support needs are and what the solutions are from family carers' perspective.
I'm very pleased to say there's a big emphasis at the moment on the whole family surrounding someone near the end of life. They're interconnected with a whole lot of relationships, some of which are professional. They are related to their GP and their doctor and their nurse and social services, but they're also related to neighbours and friends and relatives. And we're starting to appreciate that that's a really complex process and that all those people have needs and all those needs have to be met.
We have an increasingly older population. The number of people over 85 has hugely increased and will increase further. That's going to, for instance, require better integration of health and social care probably. We have a huge opportunity here in Manchester with the devolution of national budgets to a local level. So we have a unique opportunity to see how that might work and how the two, health and social care, can be integrated.
Advanced care planning is a really big matter at the moment. Everybody knows it works, everybody knows it's important, and nobody's doing it. For one thing, society isn't yet prepared to talk about it as openly as they should be. But for another thing, it's a difficult conversation to initiate. It's just bringing the decision process out into the open, so everybody's part of the team. And that is the next bit, trying to create this concept of a totally interdisciplinary team which involves medical care, clinical care, social services and the patient and the carers and the relatives and the people that are important to them, in a team where there's no levels of expertise but just a focus on making what happens right.